At the end of this video, there's this pretty big ethical dilemma, and I couldn't seem to get myself out of it, so I'm very curious to hear your opinions. Please let me know in the comments.
In order to get a good diagnosis.
Where are you getting it from? The store?
Doctors have to constantly change their perspective.
Okay.
We're asked for second opinions, hoping we'll see something others might have missed.
Yeah, that was the guy that was...
patient.
That was the guy that was always berating the nurses. I wonder what his problem is. Well, I can't believe that he isn't such a jolly soul all the time. What's going
Someone's
on?
getting fired. Stop it.
It wasn't even my patient.
What?
Nothing. How long is this gonna take?
No, what happened though? Wait, why was I... Wait, what? Alright, it'll probably pick up. I'm pretty sure I was recommended this episode. Shout out to El Pippo for recommending this episode. Unbelievable. Very mature. Dude, this guy...
That patient was inexcusable.
I've literally seen his face 4 times. And there was nothing redeeming about any of those times. Well, I guess the first... just throwing something in the rain is alright, but I mean... There's nothing sympathetic about him. Is this his own character?
And we're gonna be here till I find out who's responsible for it. So
All
until
right,
then, you
I
will
did
sit
it.
down,
It's
you
okay.
will shut up, and you'll wait to be called.
What happened? Did someone die? Malpractice?
London.
How are 50 people potentially responsible? What happened?
Someone is.
And who was on the patient in question, the one who died?
Everyone. Everyone was everywhere.
I was paged to the ER.
Wait. Oh, there is no context, is there? I see. It's just started like this, and everyone's like, what's going on? Just like me, even though they watched all 6 seasons. And then now they're gonna flash back and tell us what's going on. I see, I think.
Alright, can you lean forward and take a deep breath?
Chat. Why are they constantly doing that? Oh, wait. Right. Okay, my bad. Wait, no, not my bad. Dude, my brain isn't working right now. Sleep deprivation. So I can hear stuff when I do that. Right? But you can't see what I'm doing, so... Right? If these little things at the end are looking backwards, and you put them into your ear, it doesn't work. It's not in my ear. I don't hear anything. I don't feel anything. I can do this all I want because it's not in my ear. It's just around there somewhere. Alternatively, if I do this, and then I do that, you can't. You get what I mean, right? You get what I mean? You get what I mean? I think you get what I mean. Backwards.
Can you lean
backwards.
forward?
Like, I don't know, 6 seasons in. Am I taking crazy pills? Listen, chat. 6 seasons in. 6 seasons. No one said anything about this. Am I wrong? Is what I'm thinking right now. Do some stethoscopes work like this backwards? It's going backwards. How does that work? It's supposed to look frontwards. So it can actually go into your ear. Are these people reptiles or birds or something? I don't... How?
Okay, your lungs sound good. Your vitals are great. Open up, please.
Oh my god!
There was nothing more for me to do for her.
And at that point, you went.
I went to go help Dr. Bailey.
What happened?
Did I just say?
Did he just
I went to
faint?
go help Dr. Bailey.
Why did it take him so long to faint? I mean, all that blood everywhere. I don't know. I don't easily get fazed by stuff like that, so I can't say anything about that. But all of that going on, you're fine. But then a little bit of blood starts spewing out from an artery, and you faint from that. Oh no! I guess it's possible.
What did I just say?
What did you say?
I got it! He fainted.
He fainted.
He fainted.
From what?
Better have a brain tumor or something, because that's just unacceptable.
Come on, have some empathy. I mean, honestly, if he has a brain tumor, that makes much more sense to me as well, though. I don't know what to tell you.
Well, there was a blood drive today. This place is a freaking maze.
Oh, okay. He was hypovolemic, as in his volume was low.
These Seattle Grace people are kind of douchey.
Seattle Grace? Wait, it's called, the hospital's called Grace? That's actually pretty cool. Well, he is a douche, though. Look at him.
Case in point.
Douche.
Exactly.
I need both hands on this handle. Do not push the axe in. Do not pull the axe out. Do not move. Understand?
Yep.
So he fainted and he let go? That's why the artery
Should have
spewed?
had a cookie.
Oh my god. Unlucky, I guess. Jeez. I feel like it shouldn't be normal to be that confident in your ability to stay steady and then a couple seconds later faint. You'd feel something, right? I don't know.
Stupid, 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 stupid. Here, fly.
I'm kinda with her.
Okay, ready? 1, 2, 3, 4. I declare thumb war. Go.
I'd say this is.
What is the kid doing?
3, 4. I declare thumb war. Go.
I'd say this is deep.
What is he doing? He's pulling a no-look thumb war. I'm not gonna break eye contact. I don't need to see what you're doing. I can just feel around.
Good news, big guy. You are fine. His pulse ox looks good. Everything looks good. He's totally fine.
Pulse ox is, you just look at the oxygen saturation in the blood. It actually has a pretty cool mechanism. So, if you're a Simpson... No! I dropped my chalk. Did you like that beginning of the sentence? Where do you think I was going with that, huh? If you're a Simpson, this is your finger. If you're Simpson Slenderman, this is the little pulse oximeter that they put on your finger. It sends light from one side, and then it catches it on the other side. If the red blood cell is oxygenated, it holds the light, or the other way around if it's not. And easy peasy, a lemon squeezy. You know how much of your blood cells are saturated with oxygen. Ba, 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 ba. Nice, huh? I thought so.
Did you order pain meds?
No, Yang did. Next time I saw her, she was dying.
When you saw her, she was dying?
No, she wasn't dying. She said she had some pain.
Whose patient is bed 1, Kathy Becker?
Not mine.
She's complaining of pain.
Hey, correct. Is that bed 1?
No.
Your initials are on the chart, man.
Again, like, does this guy have one redeeming scene?
I never even seen that patient. I'm stitching up Nosedive.
Nosedive?
What's his name? The dude that fainted. Dr. Percy.
Nosedive. That's gonna stick.
Why is it nosedive though? He didn't fall on his face.
Hey, are you gonna help me with this?
Listen, it's been a week, and I don't know if you're alive or dead. So if I don't hear from you by tonight, I am calling the police and I'm reporting you as a missing person.
Do I gotta do that now though? What?
Can I ask
Hey!
something?
Hey! They did it! Woo! Yes! 6 seasons in the making! They got it! The stethoscope is facing forwards! Amber lamps. Oh my god, I'm so good. What the hell? What the hell? Oh my god, what the... So, why did I tell you all that? Why did I tell you all that? Am I going to just delete all that when I'm editing the video? Did you know that the 3rd-degree burns might not actually hurt at all? How does that work? Because the 3rd-degree burn goes so deep that it actually hurts your nerve endings. And if you don't have nerve endings, how are you gonna hurt? Makes sense, doesn't it?
Sorry, I know. You're okay, pal. You're gonna be okay.
That's what I thought at first, too. About the rain.
You're gonna be okay. That's what I thought at first. But turns out, you weren't gonna be okay.
okay. Oh, it's okay. I'm okay.
Hey, Mom. She can't breathe.
I'm okay. Right.
Pneumothorax.
What's that? A lung collapse.
Wait a minute. How does he analyze the situation if he doesn't even know what a pneumothorax is? Who is that guy?
Danny, don't let him see me die.
You're not gonna die, I promise.
I guess that's not really that's one of the less risky promises, because if she dies, then only you know if you didn't keep your promise. And if she doesn't, you kept your promise.
You were distracted. What were
Dr.
you?
Yang was making a toddler cry. Stop!
What the hell are you doing?
Okay, let me just say.
Dude, the most like cool, calm, and collected kid in the world, and you're yelling at him? Why? I wonder what he did.
I don't know how he got there. The patient was coding.
The patient was coding.
Coax are stable.
The patient was codeine. I thought it was morphine. Nice way of controlling a child. Stop! Okay, my bad. That's a very logical course of action, actually. Uh-oh. Stop! Hey! Actually, that does kind of make sense. I'm on the doctor's side now. I hate this. It's making my paradigm shift all over the place. It's like, where am I at this point? I mean, what would you say? Hey kiddo, you might die. Try the kid as a velociraptor from Jurassic Park. Easy, Blue. Easy, Blue.
Thanks.
Easy.
Had it. Stop! What the hell are you doing?
Alright, what the hell are you doing is kind of...
Who was watching that?
He's a kid. What do you mean what is he doing? He doesn't have a developed brain yet. But yeah, stop is... I think it's literally the best course of action there.
I have to sit with him until his dad comes. I've left him alone.
No, you left him. Come here. Hey, can you sit with him until his dad comes? Thanks.
You left him alone. When were you planning?
I'm sorry. I feel like you don't get to feel anything. Because he's feeling everything. His every nerve is exposed and raw. And we have to make him feel worse before he's gonna feel better. So if you're having feelings, then you need to shut them down. You need to shut them down and talk to him about his future and remind him that he has one past all of this pain. And if you can't do that, if you can't do your job, then you find someone who can and you send them to me.
I don't get what's going on here. She also left that patient alone to come and tell her to come talk to the patient that she just left alone? I don't...
It's too much swelling in the airway. Give me a smaller tube, a 6-0.
Move! She needs a crike.
This is right here. Ooh, it's a GIF. This is the thyroid cartilage, and this is the cricoid cartilage. And usually when you need to like bypass all this and just have a breathing tube right into the windpipe, then you go between the cricoid and the thyroid. So cricothyroid ligament. You just cut there. Cricothyroidotomy. Otomy just means cutting. So cricothyroidotomy, you put and then you put it in there. Cric is that. It's just putting a breathing tube in there with an incision.
Okay, here's the thing about the rain. It usually just drizzles. It's not like tonight. But when it stops, everything is super green and it's beautiful and it smells like trees. You know that smell?
She's pretty good. That's why she needed her. Do I like soccer? I mean, watching it, not really. It's kind of slow for my taste. Basketball is like something's happening at all times. No one's ever standing around and doing nothing in basketball. Unless you're doing something wrong, in which case you can point and laugh at that. But in soccer, you just wait. The field is so big.
Dr. Krebs seemed to have it under control. Krebs seemed totally out of control.
Move! She needs a crike.
Give me an amber bag. He was pale, shaky.
The amber bag is just the you know, the big balloons that you squeeze to get air. Yeah, that's it. That's the one. There it is.
You're going in blind?
It's crowded. hit the carotid.
He kept saying something about.
Well, I mean, at least he's calm. That's nice. I hit the carotid. Okay. The carotid artery is the artery that basically supplies your brain, and it's the one you can hear, that you can feel here. He's like, oh, what? Okay, well, I hit the carotid. Okay, cool. Who am I rooting for this season to win the finals? Easiest question of my life. I'm a huge Toronto fan. And guess who won last year? That's right, baby. Call him a choker again. I dare you. Call him a choker again. Call him a choker again. I dare you. Last year isn't repeating, man. You sorry? You know what? They said that last year as well. So forgive me if I don't care what people think.
Did you give blood today, Dr. Karev?
What?
You've been described as looking pale, shaky, and unsteady. We already had one doctor pass out after giving blood. I'm asking.
We all give blood. Avery gave blood, Yang gave blood, Gray gave blood. I give blood every 2 months. Just because some dumbass didn't eat a cookie.
I'm asking if you gave blood today, Dr. Karev.
No. And you...
That was kind of obvious that he was going to say no with that flashback. Like, we know, it just happened 10 minutes ago. We know he gave blood. They heard that, though. I mean, he heard that, though.
Wait. Don't stick me. I gotta go. Sorry.
Again! I like this episode. Paradigm shift here. Whiplash. Emotional whiplash. Where am I? What happened now? Did I lie? Did I not lie? Was I right? Was I in the wrong? I actually usually pride myself in not coming to conclusions too quick. But turns out I need to work on that. This episode is actually teaching me a lot about myself.
You're going in blind?
Hit the carotid, don't hit the carotid.
Oh, don't hit the carotid. Okay,
Hit the
alright.
carotid. Hit the carotid, don't hit the carotid. Hit the carotid. Hit the carotid.
I was thinking, why isn't it spewing at all? Why was that? How was that hitting an artery?
Got it.
Easy.
Start ventilating.
Got him. So what's the problem?
I got there in time. I did the crike. I stayed with her after that.
And at that point, you had her under control.
It was a good crike. She was stable. Then, out of nowhere, we started to lose her.
She's got pulmonary edema. Switch to high-frequency jet ventilation. Get a CBC, lights, ABG. Just shotgun her. Get everything. She's got pulmonary edema. Switch to high-frequency jet ventilation. Get a CBC, lights,
They're never gonna learn their
ABG.
lesson. It's backwards. He can't hear anything. You're gonna think your patient's dead. It has to look forward to go into your ear canal. Very basic. Very basic. How do you not feel that when putting it on? It literally fills up your ears this way, and this way it feels like you have nothing on. I don't understand. Like, I understand making a mistake that's simple and easy to overlook, but this isn't easy because you feel it in your ear.
She had ARDS, BP was dropping.
ARDS is acute respiratory distress. It's actually something COVID does. So basically, pneumonia is in one place, and ARDS is like diffuse everywhere. Something like that.
Oh, there's blood. Wait!
She started bleeding out.
She's got blood in her crack tube. She's got blood in the tube.
Oh my god.
Because they need extra help? Or... I killed her. Oh my god.
I know what happened. I know why she died.
She died.
I'm sorry. I am so sorry.
Dr. Kepner?
Someone that I don't care about is gonna get fired. I just met you. I knew you not.
What should you tell them? What did she say?
I believe you're good.
Dr. Weber, I
So
don't
you
know.
should be able to tell me what would have caused Kathy Becker to bleed out and die from multisystem organ failure.
She had DIC?
DIC. One of my favorite things, because it's kind of like opposites day. The body just randomly forms clots here and there, everywhere, for no reason. But the problem is The patient is bleeding? Why? Shouldn't clots just stop the bleeding? That's why I like it. It's a very scary thing. I don't like it like that. I don't like you like that, DIC. The problem is your body only has a certain amount of resources like platelets and coagulation factors and stuff. So if you're making clots willy-nilly everywhere, then at some point you're gonna run out of those. You've depleted all your factors and platelets, and then when a minor bleed happens, well, you're not gonna be able to stop it. And then it's gonna happen everywhere. And sometimes the clotting is at the forefront and it happens a bit more. And sometimes the bleeding happens a bit more. It's kind of a case-by-case basis, but I think it's pretty cool as a mechanism. I liked it when learning it, at least. Kind of went like, oh, that makes sense. Whenever I do that, I like that.
The smoke inhalation.
How did Mrs. Becker's throat look?
No, she wasn't hoarse. She wasn't.
How did it look, Dr. Kepner?
Her breath sounds were good. She
What?
respiratory.
I'm asking you. What it looked like.
Okay, your lungs sound good, and your vitals are great. Open up, please. Oh my God.
Uh-oh. Uh-oh. Mr. X-Man actually killed a person. Kind of, not really.
Okay, you look good. These burns on your chest are pretty minor, but the one on your...
Looks good from here. You look pretty alright to me.
You didn't look in her throat. Because if you had, you would have seen soot. And you would have intubated immediately. And none of this would have ever happened.
That's it.
How did the other doctor remember that? Like, I think it was happening behind her as well.
I got distracted.
I
It
know.
was
I
insane.
know. It was a simple mistake.
Very simple mistake.
And the circumstances you are under, I'm sorry, Dr. Kepler.
No, I missed one step.
And look what it's led to.
Time of death is 12:45 a.m.
You're fired.
Here's the deal. I actually don't know what really gets people fired or lose their license or whatever, really. But this is like a genuine question. Would she have been fired if the patient didn't die? Or are we just looking at like the consequences of her actions instead of the actual actions themselves? Because if she did the exact same thing, actually, here's the if she missed, I don't know. Does this make sense? Am I being dumb here? Can any doctor in the comments or the chat clear this up for me? Because if she forgot to look in anyone else's throat, nothing would have happened. So that's not really a fireable offense there, even if someone saw that, right? Is it? I mean, if it is, that just makes sense. But if it isn't, then why is it a fireable offense if the patient doesn't make it? And what if the patient was a more stable, more strong person? What about then? What if they made it through in the end? Would they have been fired then? I don't know the answers to these questions, and they are just questions that I'm throwing out. And I would love if they were answered, but I don't know. I just don't know. Like, because obviously a patient dying on its own isn't... Yeah, I guess this makes sense, though. A patient dying on its own isn't enough of a criteria. A patient... you making a mistake isn't enough of a criteria. Is it? I don't know. Yeah, I don't know. But a patient dying from a mistake... I don't know. Should she be fired? I don't know. I don't see it. Remember the episode we watched in ER? Love's Labor's Lost or something like that? He made a similar mistake, right? He missed the preeclampsia and then the patient died. Should he have been fired? I don't think he did. I didn't think he should have. I don't know.
Oh my God, Danny. Oh, God. Oh.
Danny, wait. The Shining. The kid's name was Danny, and he kind of looks like this, doesn't he?
Okay.
And he was also kind of weird.
When we're headed toward an outcome that's too horrible to face, that's when we go looking for a second opinion.
I mean, no, the opposite is true as well. If you think there's something wrong with you and the doctor can't find anything wrong with you, you get a second opinion then too.
Say it, Derek. Maybe it's not one doctor. Maybe it's too many doctors who don't know each other and who don't trust each other.
Maybe.
When I got to that room, it was chaos. Because that's the system now. Chaos.
And that's not a good system.
That has been the system that has been in place since this merger.
Yay, there was a merger. I knew it. I'm so smart. I can come to basic
I'm
conclusions.
saying you should look again at who's responsible.
Ooh. Interesting. Aw, goodbye, phone. Alright, fine. Fine, I'm kind of empathetic towards him. A bit, a little bit. Just a tiny bit.
It can shed new light.
Still a douche.
Make you see it in a whole new way.
One life just moves on like nothing happened. One life changes forever. One life is not a life anymore. How about that? Now we finally have the nice uplifting music to end the episode. You didn't see what I was doing with my left hand. I can do anything I want here right now. Oh my god. Dude, can you imagine the power? Oh, I can do whatever I want.
Hey, is she gone? Did she leave?
Yeah, she was good. She was a better doctor than I am.
I feel like you're projecting some guilt over there, you know? I don't think she said anything too bad, you know? I feel like maybe you're mad at yourself, actually.
What? Just waiting to see if you're gonna try to hit me again?
Say sorry.
I'm sorry, I was just, forget it. Rough night, right? So April missed the airway, huh? It's so stupid.
Airway first.
It's like med school 101, right?
It's pretty basic.
It was 1 second. She got distracted and she made a mistake.
That we all nearly got fired for. Those guys got a point. Thank you. What?
We nearly got fired for trying to fix what
Those
she
guys got a
screwed up.
point.
What, you didn't make any mistakes today?
Hey!
You've been
I knew she
Nearly
didn't
got
say anything
fired for
bad.
trying to fix what she screwed up in the first
Yeah,
place.
because that's our job.
Seriously. Like, this is a bad mentality to have. It's just a basic team mentality that you have to have. I mean, yeah, one person has to own up to their mistakes, sure. But, like, the worst sports teams usually just blame each other for problems and see each other's mistakes. Instead, what do we do going forward? You tell them to do that. You did this mistake. Watch out next time. Take these steps to maybe don't do that next time. And then all together, we'll try to cover up that mistake and you know, compensate for it. Instead, hey, I almost got fired for your mistake. Unacceptable condition. No.
You've been distracted for the entire weekend. Who knows what you screwed up? But our patients didn't
we just
die,
don't know.
and that's why we didn't get caught.
That's what I'm saying.
It could have happened to any one of us.
After all the opinions have been heard, and every point of view has been considered,
Here she comes.
you
Say
finally
something.
find
Someone say something.
what you were after.
April.
Too late. Not you.
The
The one
truth.
who got her fired? Not really.
You okay?
Yeah. Let's go home.
Okay, just this. Aw, spoiler alert! I think these two are a thing now. I wasn't supposed to know that.
happened today?
What about the drama? I need some suggestions on any other medical TV show or specific episode you'd like me to review. Let me know in the comments. In the meanwhile, here's another medical drama that I already reviewed. Check that out and subscribe.